My stomach feels bloated, and I haven't gone to the bathroom in days. You barely hear anything. Is that normal? Or is that a problem? Let's make bowel sounds stupid simple.
So what exactly are bowel sounds? They're the sounds created when your intestines move food, fluid, and air through the digestive tract. That movement is called peristalsis. No movement? That's a problem. Too much movement? That can be a problem too. That's why nurses pay attention to bowel sounds. There are 4 things bowel sounds can be. 1. Normoactive. This is normal. Gurgling, clicking sounds. The bowel is doing its job. 2. Hyperactive. Loud. Frequent. Sometimes you can even hear it without a stethoscope. Think diarrhea, gastroenteritis, or early bowel obstruction. The bowel is working overtime. 3. Hypoactive. Sounds are quiet, slowed down. This shows up after surgery, with certain medications, or with decreased bowel motility. 4. Absent. No sounds at all. Here's the rule. You have to listen for a full 5 minutes in each quadrant before you can call bowel sounds absent. Why does this matter? Absent bowel sounds may indicate severely decreased intestinal activity and require further evaluation. It can also be associated with conditions such as an ileus or bowel obstruction. This is not something to brush off. Here's the trap. A student hears nothing for 30 seconds and writes absent bowel sounds. Wrong. 30 seconds is not enough. You need a full 5 minutes per quadrant before you can document absent. NCLEX loves to test this exact mistake. When to notify the provider. If bowel sounds are truly absent after listening for a full 5 minutes, notify the provider. Also notify the provider if you find absent sounds along with a distended, rigid, or painful abdomen. That combination is a red flag. Pop quiz. A nurse auscultates a client's abdomen and hears no bowel sounds for 30 seconds. What should the nurse do next? A. Document absent bowel sounds. B. Notify the provider immediately. C. Continue listening before documenting absent bowel sounds. D. Begin abdominal palpation. Pause the video if you need time to think. Correct answer is C. Continue listening before documenting absent bowel sounds. Why? 30 seconds is not enough time to determine bowel sounds are absent. The nurse must continue auscultating and complete the appropriate assessment before documenting absent bowel sounds. Students often hear nothing briefly and immediately document absent bowel sounds. Don't do that. Let's lock it in. Normoactive, normal. Hyperactive, loud and fast. Hypoactive, quiet and slow. Absent, nothing, for a full 5 minutes. Absent bowel sounds plus a hard, distended belly, notify the provider. Now that we've made bowel sounds stupid simple, you'll never second-guess that documentation again. Before you go, don't forget to like, subscribe, and turn on notifications for more No BS nursing. And if you're looking for even more practice, head over to Patreon for study guides, cram sheets, fill-in-the-blank worksheets, NCLEX-style practice questions, case study scenarios, and exclusive lessons. Thanks for watching, and remember, we're here to make nursing stupid simple. I'll see you in the next one.